FaceRehab podcast series.
Welcome to FaceRehab, the facial palsy road to recovery. I'm your host, Veronika, and I'm thrilled to introduce our guest today, Trina Neville. Trina is a highly experienced physiotherapist specializing in facial palsy, bringing over 2 decades of expertise to her practice. She operates within the specialized facial palsy clinic and Queen Victoria Hospital and serves as the chair of a Facial Therapy Specialists International, contributing as a member of the Medical Advisory Board of Facial Palsy UK. In addition to her clinical work, she leads support groups, providing invaluable guidance and support to those affected by facial palsy. In today's episode, we explore the 3 stages of facial palsy, focusing on the first phase known as Flaccid Paralysis, discover various treatment options available during this stage, gain insights into the rehabilitation process, learn essential self-care practices, and understand when the journey toward movement and recovery typically begins.
Facial palsy. Road to recovery.
Welcome, Trina, and thank you for joining us on this podcast to share your expertise in this specialized field, particularly on the topic of flaccid paralysis in facial palsy.
Thank you for having me, Veronika. I'm really glad to be here discussing this with you today.
Let's start by talking about the stages of facial palsy. Why are these stages divided into 3 categories, and how does this division help us understand the condition better?
Well, facial palsy has 3 quite distinct stages that patients go through. From the beginning, when the face is paralyzed, usually on one side, very occasionally on both sides. So we would call this the flaccid paralysis stage, when nothing is working in the face. But then we need to be able to differentiate that from the other stages of recovery that patients go through. So when patients start to get a little bit of movement back in their face, we would call this the paretic stage of facial palsy. And then some patients can go on to develop some aberrant facial movement, which we call synkinesis. So this might happen, for example, when the patient is eating, that their eye is closing, or when they close their eyes, that their face gets tight or their neck pulls, or when they wash their hair in the shower, they get cramp in their neck. So there can be lots of different presentations of synkinesis. So it's important that we can understand which phase our patient is in so that we can make sure that they get the best management for that phase of their recovery.
Considering the various causes of facial palsy, such as pregnancy, tumors, or viruses, do these different causes lead to the different presentations within these groups?
That's a good question, Veronika. There are many different causes of facial palsy, over 50, in fact, from viral presentations like BellsPalsy and Ramsay-Hunt syndrome, through to surgical causes. For example, if patients have to have surgery to remove tumours from the brain, that can impact the facial nerve. But there can also be causes such as fractures. Facial palsy can be caused by stroke, which is an injury to the patient's brain. There are so many causes of facial palsy, and it's important that we understand what the cause of a patient's facial palsy is, in part so that we can ensure that they've been given the correct diagnosis. And unfortunately, we often see patients coming to us with one diagnosis and then we realise that actually they've been misdiagnosed. So we would ask a lot of questions when we assess the patient to ensure that the diagnosis they've been given is actually the correct diagnosis for them. And you can't really tell, depending on the diagnosis a patient has, where they will end up in terms of their paralysis or their prognosis for developing synkinesis. So we might think that patients with Bell's palsy, which is a type of viral presentation of facial palsy, they have a slightly lower risk of developing synkinesis. So it's believed that 80% of Bell's palsy patients, particularly if they've received steroids within the first 72 hours, that they will go on to make a full and complete recovery from their facial palsy within the first 6 to 12 weeks. However, if we look at the cohort of patients who have Ramsay-Hunt syndrome, which is caused by the shingles virus, then that percentage of patients who will make a full and complete recovery with steroids and antivirals drops to about 70%. So that means 30% of patients with Ramsay-Hunt syndrome are at risk of going on to develop synkinesis. And if patients don't get their steroids and antiviral treatment when they have Ramsay-Hunt syndrome, then actually that recovery rate can drop to about 50%. So 50% of patients will make a full recovery, 50% of patients will go on to develop synkinesis. So as you can see from what I've said, the patients getting access to steroids and antiviral medication in the early days, those first 3 critical days of developing their facial palsy, can be an important factor in how well they recover and whether or not they go on to develop synkinesis. It is important to say, however, that we do see patients who get their steroids, who get their antivirals, and still go on to develop severe synkinesis. So having this medication is not a guarantee that you won't develop synkinesis, but it does reduce the risk slightly. So I think, there are some patients who haven't had these medications and can feel quite sad that they haven't had them. But actually, even if they had have had that medication, they may still have been presenting with a severe synkinesis. So it's important not to get caught up on any regrets that patients might have from the past. We have to just move forwards positively at all times and remember that there are plenty of things that can be done to help patients, regardless of whether they have synkinesis or not. There are lots of fantastic treatment options out there for them. Obviously, some of the patients who've had, for example, brain surgery, where they've had a tumour affecting their facial nerve in the brain, this may also have affected other cranial nerves. So some of these patients may have multiple cranial nerve pathology, perhaps problems with their hearing, problems with the sensation in their face, problems with the sensation in their eye, or perhaps problems with the movement or tracking of their eyeball. So different conditions can cause different presentations of facial palsy and also different presentations of the cranial nerves themselves. And this is why it's important to understand exactly what has caused someone's facial palsy, exactly what their presentation is, and make sure that we manage their condition appropriately.
Okay, let's delve into symptoms of flaccid paralysis. What are common symptoms, and how can individuals identify if they are experiencing this stage?
Well, Veronika, there are some really common symptoms that people can look out for in the flaccid paralysis stage. So the first thing is that the facial muscles, or the muscles of facial expression, as we call them, just won't be working. And that will include all the muscles from the forehead, so raising the eyebrows, closing the eyes, being able to smile, being able to pucker the lips. All of those muscles will be affected in a typical facial palsy. It's important to note at this point that if someone has had a stroke, that we talk about the forehead and eye potentially being spared. So it's actually a test we use to check whether someone's had a lower motor neuron facial palsy, like Bell's palsy or Ramsay-Hunt syndrome, something affecting the cranial nerve, the facial nerve itself, or whether they've had a problem in the brain that has caused their facial palsy. So if we focus on the lower motor neuron facial palsy patients, those where the nerve itself has been damaged after leaving the brain, we would expect all the facial muscles on the affected side of their face to be paralyzed and not able to function or work. They would have lost tone as well. So the face would tend to be drooping on that side. And the older a patient is, the more we would expect the face to droop on the affected side. Because the patient can't close their eye, the eye can look quite wide compared to the other side, and a bit like a sort of wide staring eye. I've had patients describe it as before. So that's something to look out for. And the corner of the mouth can look dropped compared to the other side. Sometimes people find they're unable to breathe out of their nostril on the affected side because it's paralysed and sort of dropped inwards. So they might find they have to stretch the cheek out to allow themselves to breathe through the nostril on that affected side. Now, the facial nerve, as well as innervating the muscles of facial expression, actually innervates a couple of other special sensory nerves, including creating tears in the tear duct and creating saliva in the salivary duct. So we do find that patients can have a dry eye that doesn't actually create tears, or they can have an excessively watery eye, because a dry eye can also become very watery. So that's something we look out for. They can have mouth dryness as well, although the facial nerve does only innervate some of the submandibular glands. So as long as they have their parotid gland, they tend to not struggle with this too much. But patients who've had parotid surgery, so surgery to perhaps remove their parotid gland due to a cancer, they're going to have a lot more problems with mouth dryness. So we would watch out for that, particularly with those patients. The facial nerve also controls a muscle in the inner ear called the stapedius muscle, which is a sound muffler. So when people have facial palsy in the acute stages, they may have something called hyperacusis, which is when sounds appear excessively loud, and that will usually settle down fairly swiftly. But patients can sometimes complain of tinnitus following that. And finally, in the tongue, the facial nerve can control some of the taste to the anterior 2/3 of the tongue. So it's not unusual for patients to say that their food tastes different. Sometimes they complain of a metallic taste. So there's a variety of symptoms that can be very common in the flaccid paralysis stage of facial palsy.
When facial muscles are immobile during flaccid paralysis, what physiological changes occur in the face?
Well, the best way to think about this question, Veronika, is to think about what happens to our body when we're immobile. So if we were to sit in a chair and not move our body at all for a couple of weeks, we would get incredibly stiff. And that can also happen in the face. So it's very common for muscle stiffness to set in within a couple of weeks of the facial palsy occurring. And that's something we're particularly mindful of in the eyelid, because the eye, when it's not closing, therefore the eyelid is not moving up and down regularly for multiple times of blinking every minute, for closure at night. That eyelid can get very stiff and very shortened very quickly. So we can actually see changes happening in the muscle as they get stiff and short and become contracted over time. So that's something we really have to be aware of and make sure that we prevent. It's much easier to prevent this stiffness and tightness happening than to try and resolve it once it has happened. So prevention really is important at this stage.
I understand. What specific recommendations do you have for individuals in this initial stage to aid in their recovery and overall well-being?
Well, there's a lot of recommendations that I would have in this initial stage of flaccid paralysis. And the first is, as I said previously, if it's within the first 3 days, 72 hours, to get to the doctor or to an emergency room and to get steroids and or antivirals, depending on the cause of the facial paralysis, to ensure the best chance of making a fuller recovery. Although, as I said previously, it doesn't guarantee a full recovery. So when patients present to me, it's often a little later than that. and their first concern is how can they make sure that they get their face moving again. So I would really urge patients in the initial stage of flaccid paralysis to just rest and let their facial nerve recover. There is nothing you can do at this stage to speed up nerve recovery other than look after your well-being. So get plenty of rest, get plenty of sleep, eat well, take some gentle exercise, fresh air. Just try and look after your well-being generally so that your body is able to heal to the best of its ability. But don't try and force the face to move. This is actually one of the worst things you can do during the initial stage of flaccid paralysis. If you try and force your face to move, you'll often set up incorrect movement habits that will be difficult to fix later on. So at this early stage, one of the critical things is just rest and look after your eye. Because your eye is not able to close, it's really important to make sure that the eye doesn't get dry, it doesn't get damaged, because in severe cases that could lead to an eye abrasion and then ulceration in the eye, and it can even lead to loss of sight. So this really is important to look after the eye. So we recommend stretching the eyelid to make sure it doesn't get tight, using various taping techniques to help the eye close at night, to protect the eye as best you can during the day, make sure it's less exposed. I also recommend various eye protection measures. You can even get special glasses called moisture chamber glasses, which can protect the eye, or just wearing wraparound sunglasses. You can get external weights that you can stick onto the eyelid that can help the eyelid close. So there are lots of specialist advice and strategies that can improve eye closure in this early stage whilst the muscles are not recovering. But trying to force the eye to close is not something that will help. We generally recommend patients use preservative-free eye drops at this stage, and that's because anyone with facial palsy we would class as being at risk of severe dry eye, because not only is their eye unable to close properly, therefore liquid evaporates off the eye, what we call evaporative dry eye, but also their tear duct might be affected, so they're not even producing the same number of tears. So there's a lack of tears causing dry eye as well as evaporation causing dry eye. So they really need to use eye drops regularly, probably every hour to 2 hours. And because they're using them this regularly, it's important that they are preservative free. Otherwise, the preservatives are not good for the eye surface. The other recommendation I make is that functionally it can be difficult to speak, to eat, to drink. So taping the face on the affected side to just support it and lift it can be useful. And that will help in a few ways. It will help improve the clarity of speech. It will help reduce dribbling during eating and drinking. And it will also help to reduce the amount of overactivity that you can get on the unaffected side of your face, because that unaffected side tries to compensate and take over for the lack of activity in the affected side. So that's something we have to manage as well, and work on sort of not overcompensating too much with that unaffected side. We actually get patients to stretch that unaffected side to make sure it doesn't get too tight from being overactive. And we just generally get people to be gentle with their facial movements. There's a misconception that we need to be strong to move our face. And actually, facial movement is very small, very gentle, very precise, coordinated and delicate. So there's no need to go for big facial movements and gross facial exercises. That's not how our face works. So this is the stage where I would be teaching patients how our face actually works, what normal facial movement is, and getting them just to concentrate on being gentle with all their facial movements, so that they don't set themselves up for problems later down the line. So making sure that the unaffected side doesn't get tight, doesn't get stiff from overuse. But equally, I don't want to encourage my patients to suppress the movement of their face completely, because actually moving your face is important for how you feel. So there's something called the facial feedback hypothesis that means that when we feel a certain emotion, our face responds to that emotion. So if we feel happy, we smile. But it actually works in reverse as well. So if we smile, we feel happy. So if someone was to actually suppress their emotion and say, right, I don't want to overwork my face, so I'm not going to move my face at all, then that would put them at risk of feeling low in mood. So it's important we strike this balance between getting gentle facial movement but not over-exaggerating the facial movement. There's other recommendations as well. If people have dry mouth, they can use dry mouth supplements and avoid any toothpaste, for example, that have sodium lauryl sulfate in them, which is a foaming agent which can dry the mouth. So there are specific dry mouth supplements out there people can use, and they can just take simple steps to avoid drying agents for the mouth. In terms of eating and drinking, using fine china or crystal glasses, anything that doesn't have a thick rim will be better for drinking out of and cause less dribbling. And for eating, just trying to take very small mouthfuls can make life a lot easier when you're eating, and just having napkins to hand ready to cover your mouth or mop up any drips that do happen. We often say, it's important to continue to socialise if you feel you can. We know that people who get back out and socialise early do better in terms of their recovery. So just simple things like, if you're in a restaurant, sitting with your back to the restaurant so other people can't see you if you feel a little self-conscious, but trying to persevere with still socializing, seeing friends, because that will aid your well-being, and that will aid your recovery in some ways. It's important to note that it is fairly common for people with facial palsy to feel a little low in mood, perhaps a little anxious or depressed. And so I always recommend, if people are struggling with that they do seek some psychological help, maybe some talking therapy, speaking to their medical practitioners to see if they need any medication to help them with their mood, even if it's just in the short term whilst they're overcoming these difficulties. So getting that psychological support is absolutely vital to support the physical recovery of the facial paralysis as well.
We've covered a few don'ts already, but we're eager to hear any more recommendations you might have to avoid during the flaccid stage, ensuring we prevent complications or delays in the recovery process.
Big facial movements or gross facial exercises, it can be incredibly tempting to try and go to the mirror and see if your face is moving and try and force it to move. But actually, this is one of the worst things people can do. Unfortunately, there's a lot of incorrect advice out there on the internet, for example, where people have had a short-term facial palsy that's recovered within the first sort of 4 to 6 weeks. And they've been doing these exercises, or they've gone to have acupuncture, or they've tried taking wacky medications. And because their face is recovered, they have decided that it must be the exercise or the acupuncture or the wacky medication that made them recover. Whereas in actual fact, it was just the fact their nerve recovered anyway. So it would have recovered without the wacky medication, without the acupuncture, without the exercise. But they then put their advice out there for other patients saying, oh, do these big facial exercises. They helped me, so they'll help you too. And the patients who don't make a quick recovery, who do these exercises on the advice of non-experts, can then go on to get lots of other problems. So their face can become a lot tighter, a lot more overactive, and they can develop a lot more synkinesis than patients who have just taken it easy, let their face rest and recover. So really, really important that they don't do these sort of forceful movements of the face or try and force it to move at this stage. That's the main thing I would encourage people to avoid during the flaccid stage. It really is a question of resting and waiting for the nerve to recover rather than doing anything active at this stage. There are fantastic things, as I said before, that people can be proactive in looking after their eye, in taping their cheek, in looking after their dry mouth. And they can also work on relaxation, because the face, the brain, when the face is paralyzed, can go into panic mode and can really think, gosh, I've got to try and pull up the face. I've got to pull it up, pull it up, pull it up. So it can be hard for the face to actually, and for the brain to actually relax at this stage, because it's constantly trying to pull up this paralyzed muscle. So even starting some relaxation work at this stage can be really beneficial later on, to make sure the face doesn't actually forget how to relax or get too out of practice of that relaxation. But overall, you really need to avoid trying to force the face to move. It's the worst thing people can do at this stage. The other thing I always recommend people avoid, which can be recommended in some places, is electrical stimulation. There's no good evidence for or against electrical stimulation. However, from the evidence I've reviewed, there has been it has tended to show that it leads to more synkinesis, and this is also my anecdotal experience in my practice over many years of treating patients with facial palsy, is that those who have used electrical stimulation in the early stages have tended to complain that it has made their face tighter, and we feel it has gone on to make their synkinesis worse. So I don't recommend anyone use any electrical treatments at any stage of their recovery, but particularly not in the flaccid stage.
The burning question on many minds is, how long does the flaccid stage typically last? Additionally, are there proactive measures individuals can take to speed up the recovery process?
Well, there isn't really a typical amount of time the flaccid stage lasts, because some patients will get a nice quick recovery, as I already discussed, whereas some patients will take a lot longer to recover. But if we split the patients into those two groups, then I would say that generally the patients who kind of recover quicker will tend to start to get movement within the first couple of weeks of facial palsy. So usually we'll see some sort of movement by week 4 to 6. If we don't see that, then it's likely that patients will fall into this second group where the recovery is going to take a lot longer. And generally then the flaccid stage would actually last about 4 months. So we wouldn't be shocked or surprised if someone said, I've had this for 3 months and I've seen no recovery and we're panicking. And I would say, don't panic. This is perfectly typical in a longer lasting recovery for the flaccid stage to last this sort of 4 to 6 months. The only time we would start to be a little concerned is if the patient still got no recovery beyond the 4 to 6 month mark. And then we would definitely be wanting to make sure that further investigations were done. So if someone has a very long flaccid stage that appears to be showing no signs of recovery after 6 months, then we would certainly be doing further testing for those patients to make sure there was nothing else going on causing that prolonged flaccid paralysis. So generally, the longer the flaccid stage of the paralysis lasts is a bit of a predictor of whether someone will develop synkinesis or not. So it's fair to say that if someone has a flaccid paralysis for 4 months, then it's almost inevitable that they will develop some sort of synkinesis. But how severe that will be can be in some ways moderated by the steps they take in the early days. So you can't speed up the nerve recovery process per se, other than by looking after your well-being and resting up and giving your body every chance to recover. However, you can give yourself an advantage in terms of less risk of synkinesis and more likelihood of less severe synkinesis or a better recovery by following the advice I've already given, which is to rest, not try and force your face to move, look after your eye, look after your oral health, stretch the unaffected side of the face. You can massage the face to make sure it stays nice and supple. So all of these things, they're not going to speed up the recovery process, but they are going to optimize the outcome that our patients get. And that's really why working with a specialist facial therapist can be so important to optimize recovery. And I'd really urge patients to work with specialist facial therapists. And those facial therapists need to be trained. It's not covered in their undergraduate degree course. So I would always say, ask your facial therapist what extra training have they done, who have they trained with, and make sure that they've done a significant amount of postgraduate facial training and have lots of expertise in treating patients with facial palsy, because it is a very specialist area, and unfortunately some therapists will give incorrect advice and management. So you can't assume that every physiotherapist or speech therapist or occupational therapist will know how to treat facial palsy. Please make sure you find someone who has a lot of experience and a lot of additional training. That's really important.
You mentioned earlier the significance of eye care during this stage. Could you explain further on why taking care of the eyes is so essential at this phase? Let's delve deeper into this topic.
When your eye is not blinking, it's incapable of protecting itself. So normally if grit or dust flew at our eye, we would quickly blink and protect our eye. But when you have facial palsy, you just can't do that. So it's much more likely that there's going to be an injury to the eyeball during this phase when you can't blink. So a simple abrasion injury can quite quickly turn into ulceration, and potentially even blindness, as I said before. So if patients aren't looking after their eye, if they're not wearing some sort of protective eyewear when they're out and about, if they're not taping their eye closed at night, if they're not using eye drops to keep their eye moist and healthy, then they're going to suffer with a lot more eye irritation, eye dryness, and they're going to be a lot more at risk of these more severe eye injuries and potentially even blindness. So really vital to care for the eye during this stage of facial palsy, and at any stage of facial palsy, eye care remains really critical. And patients who have a loss of sensation in the eyeball, which is not common with facial palsy, but some patients, as I said before, with different diagnoses can have multiple cranial nerve pathologies, and some of them may have numbness of the eye. They're at increased risk because they won't even know if their eye is painful. So they really need to be under the care of eye specialists. The other thing we see with the eye is that when we try to close our eye, normally if our eye won't close, our eyeball will actually roll up to protect the cornea, the coloured part of the eye. So you will see the white of the eye, and if patients have someone else look at their eye or they take a selfie of their eye when they're trying to close it, they may well see this. We call this the Bell's phenomenon. And if someone has what we call a negative Bell's phenomenon, i.e. they try to close their eye won't close, but their eyeball doesn't roll up so they can still see the coloured part of their eye when they're trying to close the eye, that's another critical patient group that I would suggest get assessed by an eye specialist early on and monitored regularly, because again they're going to be more at risk of damage to the vital parts of the eye during recovery. So they really do need to be carefully monitored and carefully managed. So there is lots of help that can be given for the eye. I've already mentioned external eyelid weights, taping for the eye, wearing protective eyewear, including specialist moisture chamber glasses. And there are surgeries that can be done for the eye as well, if necessary. We wouldn't do anything too early, but if someone's really struggling with their eye closure, then they may put a little weight in the eyelid to help the eyelid closed. Or if the lower lid is extremely dropped and not improving, they may do surgery to support the lower lid. But that can be done with taping in the short term whilst we see what recovery occurs. So eye care, really, really important. We don't want any severe eye injuries, abrasions, ulceration, or potential blindness happening. So we need to take every precaution during this stage to prevent that.
With a lot of information available, especially regarding treatments like exercising, electrostimulation, and acupuncture, what treatments are advisable and which ones should be approached with caution during flaccid paralysis?
We should absolutely avoid any facial exercise when the facial nerve is not working. It's a bit like trying to turn on a lamp that isn't plugged in at the wall. You can keep trying to turn on that lamp, but it's not going to turn on, and the chances are you're just going to break the lamp. So whilst that nerve is recovering, there is no signal coming between the brain and the facial muscles. So trying to force those muscles to work is absolutely futile. It's not going to work. So trying to exercise the face is just not advisable, not worthwhile, and is going to cause more problems further down the line. The same thing with electrical stimulation. We've already talked about that. And the fact that in my experience, electrical stimulation causes more risk of synkinesis. There is some evidence that electrical stimulation can reduce motor end plate innervation, so the ability of the nerve to actually re-innervate the muscles so well. And there is good evidence for other types of treatment, like massage, for example. We know that when we massage the face and increase the blood flow, that in studies that they've actually done on mice and rats, that the massage, the physical touch has actually improved the nerve recovery in a way that electrical stimulation didn't. So that's why we recommend going with the treatments that we know are more likely to improve recovery, and avoiding the treatments that we know are more likely to not improve recovery and potentially even cause difficulties down the line. In terms of acupuncture, I think that acupuncture can be really helpful in terms of improving well-being. So if people are struggling with fatigue and trying to generally get over a nasty virus, then acupuncture can be really beneficial for that. We don't really have enough evidence to say whether it's beneficial in terms of speeding up nerve recovery. It's possible that it improves blood flow slightly, but I don't think there's any particular benefit to it in that respect over and above what you can already do with your hands, which is massage your face to improve the blood flow and maintain the suppleness of the face. So I think that if people can afford to have acupuncture and it's a nice adjunct to improving their well-being, then that's fine. But if they can't, then I don't think it's something necessary at all. And I think that people can do a great job just with massaging their face, relaxing their face, resting up, using tape as required, keeping the unaffected side of the face stretched out, and generally just trying to learn about facial movement, what facial movement is, how it works, and just really educating themselves in that way. That's the most important thing to do during the flaccid paralysis stage.
And recognizing also the emotional challenges faced by patients during this stage. Can you share recommended coping strategies to help them navigate these difficulties?
Yes, it's really, really important to recognize the emotional challenge that patients with facial palsy face. It's through various research projects, we've shown that patients with facial palsy are more likely to experience anxiety and or depression than people without facial palsy. So it's important that they seek support, whether this be from family or friends or medical professionals or specialist facial therapists. That support is really, really vital to help get people through this very difficult time. I think that speaking to specialists who understand facial palsy is vital. There can be a lot of fear around the facial palsy. Will I ever get better? So having someone that can educate you well can really help you to cope better. I think understanding a medical condition is often what people need to be able to cope with it. So finding the specialist information through apps like FaceRehab, through websites like Facial Palsy UK, that can be really, really helpful as a coping strategy as well. And I would also say that accessing support groups, so whether that be online support groups through Facebook groups, or even better, in-person support groups. So, for example, Facial Palsy UK, which is a UK-based charity for patients with facial palsy, they run physical support groups throughout the UK that patients can go to, and these are run by patients but also by healthcare professionals. So we know that patients accessing those support groups are going to get good quality advice. I always urge caution if patients are jumping onto Facebook support groups, for example, in terms of what advice you might get from non-specialists. So I think it's important to make sure that any advice you get and follow is put out there by people who know what they're talking about. Otherwise, you might feel that that's helping you, but it might be making things worse in the long term. I think that if people feel really low, they need to seek expert help. So seeking help from psychological therapists, maybe some talking therapy can be very valuable, or medical assistance, even for a short-term period, just to help with any depression or anxiety. It's important not to suffer alone. And we know that those people who put themselves out there and try to keep going with seeing their friends, continuing their social life, continue going to work, they do better long term than patients who sort of hide away, who don't leave the house, who can become a little bit isolated, because that can really impact your mood as well. You know, if you're not with other people, you're less likely to feel happy and to get involved, and that can actually lower your mood even further. So just trying where possible to leave the house, even if it's just for a short walk with a friend, to see a friend, to go to work, even if it's just for short periods, to do those little things which will actually give you an emotional boost, if you feel well enough, of course. But the most important thing, of course, is if you're really struggling with your mental health, please seek help from a mental health specialist, and please don't suffer in silence. There is support out there for you.
Lastly, Trina, is there any empowering message or advice you'd like to share directly with patients currently experiencing flaccid paralysis? Yeah, definitely. You know, just to really follow up on everything I've said today, which is that you're not alone. There are specialists who work in this area who have spent their whole career focused on facial palsy, who are out there who want to help you. So seek out those specialists, access that specialist help, access specialist advice. Don't suffer alone. There is so much that can be done to help facial palsy in the right way. So it's really important to find the right people that can give you that correct advice, and can really make sure you optimize your recovery for the long term. Thank you so much, Trina, for your shared knowledge in this podcast. In the next episode, we are going to talk about the Paresis stage of facial palsy together. I want to also remind our listeners that they can find even more resources and support in FaceRehab mobile application and on our website FaceRehab.com, where they can also book online video consultations with facial specialists. Thank you for being with us today, Trina, and thanks for sharing all of your tips and advice.
Thank you so much for having me and for letting me share my knowledge and my advice. And I hope that it's been really useful for your listeners. Thank you.
Facial Palsy. Road to recovery.
If you enjoyed today's episode, please subscribe to our podcast and leave us a review on your favorite podcast platform. We also invite you to join the BellsPalsy and facial paralysis support group by FaceRehab on Facebook. where you can connect with others who are living with facial palsy and share your experiences. Thank you for joining us today. Until next time, take care of yourself and remember that you are not alone in your journey to recovery.
Face Rehab. Bring your smile back.